Hi, I'm Vicki Libiakis, and welcome to Body Beautiful. This is a show where we talk with local professionals about the latest in cosmetic procedures and medical devices. We also take your calls live on the air. With us today, we have plastic surgeon Dr. Joseph Mele, and we're talking about liquid facelifts. Later, we'll be taking your calls, answering any questions you might have for the doctor. Here's our phone number, 415-561-8753. We'll also be posting the phone number to the doctor's office, so be ready to jot that down. And before we get started, any advice we give you today, certainly you'll want to consult your own physician as well. Welcome back to the program, Dr. Mele.
Nice to be here, thanks.
I noticed by the color of your shirt, it is festive.
It's that holiday season.
It is the holiday season. A lot of parties, a lot of changes taking place. What if you want to, let's just say, freshen up your outlook for the new year and maybe freshen up your look? What are some of the possibilities for us?
Sure, well, things that are sort of quick fixes that don't have big long recoveries that are great for the holiday seasons are some of the fillers, like the Restylane, Perlane, Juvederm, Radiesse are some of the fillers that we can use, or some of the neuromodulators like Botox, Dysport, and the new one is Xeomin. Those are things you can come into the office, have done. Worst thing that happens is once in a while we get a bruise, which goes away in a few days. In the most part, many times we do not get any bruising, and then you can go out and do what you need to do.
Okay, so we threw out the term liquid facelift. Is that kind of the catch-all phrase for some of these products?
Yeah, it's kind of a snazzy way to say what we're up to. It's not the same as a facelift. Facelift surgery really is to get rid of extra skin and redrape that extra skin and smooth out areas of the lower face and neck in particular. These work better in the areas where we use them, which is along the nasolabial folds, that line that runs from the nose to the mouth, these marionette lines down lower, the fine lines we get around the lips, the little wrinkle lines that bleed the lipstick out. These fillers actually work better than facelifts in those areas.
All right. Some might say time is our enemy. So is gravity.
Gravity too, yeah.
Gravity.
And it's a loss of elasticity. And as we age, we also lose the natural stuffing on our face, which is fat. If you look at little babies, they have big, round, fat faces. And as we age, we get a more elongated face as we lose that stuffing. And this is a way to put some of that back.
Okay, so the fillers accomplish that.
Yes.
You know, some people get this confused. Yeah, the fillers are what plump things up, and the neuromodulators,
yeah, Botox.
The Botox
which is what everyone calls it.
But there are other products out there now that are competing. They paralyze the muscles so that you're not scrunching so much. And
right, because lines are caused by different things. In the forehead, we have the transverse lines that run across the forehead from raising our eyebrows, or the 11s, they call them, the lines that run up and down between the eyebrows. Those are caused because of muscle motion. So we call those animation lines. As we animate, it folds the skin and we get those lines. What the Botox does is stop you from being able to do that.
Okay.
And when done properly, it doesn't look odd. You can still make expressions, but not enough to get those lines.
That's the fear. You know, we see a lot of people in Hollywood where they have that kind of frozen expression, and I know you as a professional look at that and go, okay, a little too heavy in the Botox department.
It's like anything else. Enough is enough. Too much starts to look a little bit odd. And I'd much rather undercorrect and have someone have some animation. And even if they retain some lines, you always have the opportunity to go back, put a little bit more in. Or if you overcorrect, since these last for months, the overcorrection lasts for months.
But the good news is that eventually your body does absorb it, and
yeah, it always goes away, which is good news, bad news.
Right.
If you like the results, it's bad news.
Well, we were talking about time and time not being on your side when it comes. Well, of course, it's better than the alternative. Certainly.
Yes, yeah, I like to be around to complain.
Yes, exactly. But if you are trying to just forestall, maybe if you feel maybe you need a surgical procedure, but it's not a good time in terms of your budget, is this a good way to just sort of stop the clock for a bit, or
it's a great
buy
way.
yourself some time?
It depends, of course, on where the aging process is having the greatest effect. But if it's areas around the mouth, around the nose, sort of the central part of the face, I think these are a great way to forestall it. The things I want to find for someone who's coming in for a facelift, the things I want to be able to correct are usually sort of lower on the neck, on the jowl lines, the deeper lines in this area. Those, if you have one out of those three, sometimes we can correct what we can correct with the fillers, and that allows us to sort of postpone doing anything else.
So who's a good candidate for the liquid facelift?
Healthy folks who, for some of the medications, can't be allergic to sulfites, but most of them do not have allergy problems. And the reason for that is they are a normal component of the skin. Most of them are made of hyaluronic acid, which is a component of our skin, so you shouldn't be allergic to yourself. So that works very well. And folks who have lines that can be corrected without causing problems. So I wouldn't use Botox around the mouth. it will get rid of the lines, but you'll look like you had a stroke. You won't be able to move.
Okay.
Not a
not
good
a good
idea.
look.
No. So we use fillers in those areas. The fillers are soft, they move with normal motion. You can animate, talk, everything normally, yet still have a decrease in those lines.
Okay, we need to take a very quick break.